my name is Tori.
And I'm Maddie.
And we did our informative poster on a waterway to floss, which is looking at taking a deeper look into the water flosser. The reason we chose this topic is because oral health continues to be a public health concern, and a large percentage of the adult population is diagnosed with periodontal disease. Home oral care is the best and most effective way to prevent periodontal disease. So when a water flosser is used in combination with toothbrushing, it's the best way to prevent any periodontal disease from occurring. So what is a water flosser? A water flosser is a generic term for a device that safely pulsates water in between your teeth and around your teeth. And what it does is it actually goes down into the gingival margin up to 6 millimeters, and it flushes out the debris and bacteria. So it's a really good way to make sure that with regular flossing, you're just going on the surface. You can't go underneath the gingival margin, but with a water flosser, you can do that.
Okay, so with our methods and results, we took information from current peer-reviewed articles that provides information about the benefits of a water flosser. So we have 3 different studies and results here. So the first one is done in a laboratory setting and has 3 different species of biofilm that is grown on a hydroxyapatite disc and was incubated in a saliva solution. And after they were grown on the disc, they were put in an interproximal device and underwent treatment with a sonic toothbrush and a water flosser with 10 seconds and 3 different interval days. So with the sonic toothbrush, it showed that it only had 41% reduction on its greatest day, and the water flosser had a 63 to 83% reduction of biofilm removal and had the least residual bacteria left on the disc. So with the second method and study, it was a single-centered blinded study with 52 healthy patients with mild to moderate periodontitis, and they were brought into 3 separate groups. So Group A was told not to brush for 14 days, Group B was told to have the regular oral hygiene, and Group C was told to use a water flosser along with their regular oral hygiene. And clinical assessments were taken to measure their clinical attachment levels, bleeding on probing, and plaque and gingival index. So the results showed that those who used the water flosser and the regular oral hygiene had the greatest reduction in all the clinical assessments, and cytokine levels were measured, and 2 of the 4 of them were decreased in those who used the water flosser. So with our last study, we had a randomized study of 8 periodontitis patients with 5 millimeter pockets or greater and radiographic bone loss. So those patients were treated by a 4-quadrant assignment. So the first quadrant was a control group, and the second was underwent scaling and root planing. The third quadrant underwent scaling and root planing and under professional subgingival irrigation of chlorhexidine rinse with the water flosser. And the last quadrant had only the water flosser with the chlorhexidine rinse. And so clinical assessments were taken and 3 different interval days were treated. So the results showed that the water flosser with the scaling and root planing had the highest improvement of all the clinical assessments, and they had 136.8% reduction of all of the assessments compared to the other control groups. So this just comes to show that the water flosser is not only good for the use of water, but good for the use of other oral health rinses and reducing clinical assessments.
We also found that there are many benefits to a water flosser, which it removes biofilm, reduces bleeding, and reduces gingival inflammation, reduces periodontal pathogens, and reduces inflammatory mediators. When you look at the statistics of regular flossing and toothbrushing compared to brushing and using a water flosser, there's a 29% more reduction in plaque removal than compared to the other 2. So we also found that there's many patients that can benefit from using a water flosser, which include patients that are non-compliant with dental floss, patients that have implants, patients that have diabetes or special needs such as dexterity issues, and also ortho appliances benefit greatly from the use of a water flosser. So altogether, we found that compared to regular flossing and other interdental aids, that the water flosser is more effective in removing biofilm and reaching deep into the periodontal pocket. That's all we have.
Thank you.
Thank you.